International Women's Health Coalition. She's Senior Program Officer and focuses on international policy, and she will talk to us about primarily health issues.
Thank you. As the previous speaker just mentioned, unless we put people at the center of development, including 2/3 of the world's poor, who are women, we will not achieve a healthy and just planet for generations to come. Today there are 1.8 billion young people alive, and their sexual and reproductive choices are what are going to determine the future of development and poverty alleviation and sustainability. So we ask governments in this conference, and we've been working very hard with members of different major groups as well, to unite in protecting women's human rights, particularly their reproductive rights, so that they're able to make informed choices about their fertility and their reproductive health, that they prioritize the most poor through primary health care, and guarantee women's bodily autonomy, affordable access to medicines, because in order to participate in the economy, in governance, in participation, in jobs, to have security, people need to be healthy. So key investments in health are crucial to this conference. The negotiations in the last few days have shown that governments are willing to set back on their commitments for over 20 years on women's human rights, on women's reproductive health and reproductive rights. And we are angry and willing to make lots of noise to make sure that governments do not set back on these commitments and reaffirm them in order to implement what they've been saying that they would do for the world's people in the years to come. Thank you.
Another impact, obviously, of not going to sustainable models is the health impact. Alexandra, you want to add a few comments on some of the things that we're not working that need to do?
In the negotiations, there's been quite a lot of discussion of why sexual and reproductive health, gender equality, and women's human rights are linked to sustainable development. So a number of governments have had to make the case over and over again that investments in basic health services such as maternity care, contraception, HIV prevention, and treatment are vital in order to keep the poorest communities and the most vulnerable healthy, and then therefore able to participate in social life, in economic life of the planet. And there's quite a lot of resistance coming from the Holy See, who has its own views on the Church and the Catholic Church, and this is creating a stalemate in the negotiations when women don't exist in that particular part of the world, and they're not citizens there, and they can't. One person in a negotiation cannot hold up the bodily autonomy and the rights of half the world's population. So I think this is something that we need to be very strong about, and to continue to press governments to do what they've committed to before, and to also implement these provisions, particularly for women's health care.